We estimate that 1 in 4 people in the United States experiences a mental illness in their lifetime, and at any given time in the United States, about 25% of our population has a mental illness.
All of us experience a certain level of stress, anxiety, or depression at some time in our lives, and 10% of children in the U.S. are impacted by emotional and mental disorders that cause significant functional impairment.
So it's a much larger problem, I think, than people understand. Mental illness is not a human failing or a weakness, and that's why people attach shame to it, because they think that it's a moral failing or something that they did wrong, or God is punishing them. And it isn't. There is a physiological basis for mental illnesses.
Almost everyone is touched in some way through some sort of mental health issue.
With physical illness, you go to a doctor, you have a problem, and you're treated. With mental illness, I think people really struggle in coming forward because they think that they can control it.
Poor mental health affects not just the person struggling, it affects the life of the entire community. Untreated mental illness can result in unemployment, homelessness, domestic violence, alcohol and drug abuse, suicide, and so much more.
The way that people view the world is all filtered through our minds. Our minds really are the key to how we experience our lives.
For 45 years, the Mental Health Association of Frederick County and their programs have had a tremendous impact on the community.
I believe that the Mental Health Association has come in as a, let's call it a safety net. I actually like to refer to it as the glue that keeps the community together.
Providing a range of programs improves the stability and well-being of families and individuals. MHA services include counseling services, the Frederick County Hotline, supervised visitation and monitored transfer, child care provider training, and many others.
But the real impact that we make is one person at a time. When somebody calls the suicide hotline and we're able to talk them out of committing suicide.
Last year, the Mental Health Association answered about 700 suicide-related calls. We are the first line for help.
I have heard on the phone lives being saved. That's a pretty huge reward.
Hundreds of thousands of Frederick County residents have reached out to MHA for education, prevention, advocacy, and intervention. As the community grows and the increasing demands on people's daily lives take their toll, MHA's services become more and more needed. Unless we are able to improve the general mental health of Frederick County, we'll see all of the community suffer.
We are about 3 times larger than we were 10 years ago, both in terms of the number of people that we serve and the number of programs in our budget. We estimate that we serve about 41,000 people a year just in Frederick County.
In order to meet the demand for services and programs, the staff and board of the Mental Health Association recognize that something must be done.
The Mental Health Association is busting at the seams right now. We do not have a large enough facility.
You can only cram so many desks in a room. If you take a tour of the current Mental Health Association building, you'll see that every inch of space is being used and more.
So we just are woefully inadequate in our physical facilities, so we need to grow.
The Mental Health Association is embarking on an ambitious capital campaign, one that will allow them to renovate and move into a newly purchased building. The campaign is called Making Room for Mental Health.
It's got at least 2 meetings. One is making room for the building, for our offices, for all of our services, but making room in people's minds for the idea of mental health.
We're changing the view of mental health as a major issue facing our community and the nation.
And today, with the economy the way it is, the stress that families are under, our mental health is very, very important.
Absolutely, there's hope.
Whether it's your dollars, your volunteer time, speaking to others, promoting our message, anything that could be done would just be wonderful.
Life is short, the time is now.
For more information, please call 301-663-0011 and online at www.fcmha.org. Thank you.